Hey, it's Dr. Dan, and one of the questions I get asked all the time is, what is the difference between a naturopathic doctor and a traditional Western medicine MD? Well, one of the things I could tell you is that naturopathic doctors operate on a set of principles, and that's what I want to get into today. What are these vaunted naturopathic principles? Well, let's get into it. Number one, same one as Western medical doctors, Hippocratic Oath, first do no harm. Now, I would venture that naturopaths have a little bit different interpretation of this. We have what's called a therapeutic order. We start gentle and we kind of work our way up to drugs and surgery. And those are kind of a last resort, not a first line of care. And that's where our interpretation of first do no harm actually is a little bit different. We'll start gentle, work our way up to drugs and surgery. You wouldn't hit something with a hammer if you didn't need to. Second principle, the healing power of nature. Now, this sounds a little hippy-dippy, right? Oh, Mother Nature's gonna do this. But here's what it breaks down to. The body has this amazing ability to heal itself, and so we respect that as naturopathic doctors. For example, you ever cut your finger? What happens if you don't do anything? Well, after a couple weeks, it just heals up, and it does it gradually and little by little by little. So naturopathic doctors work with that process in the body. We help the body to heal itself rather than suppress it with drugs. Doesn't mean that we don't prescribe drugs or refer people to other doctors for internal medicine and surgery. We do it all the time. But if there's something we can do to help bolster the body's own ability to get it done, we support that, and that's the kind of things that you see in a naturopathic treatment plan that's a little bit different. The next principle I want to talk about is treat the whole person. Now, sometimes you go to a doctor and they will refer you to a specialist, and sometimes they've got to refer you to many specialists, or a specialist will refer you to a specialist. When you go to that specialist, let's say it's for gastrointestinal stuff, they're kind of looking through this tunnel vision. They're looking at it through the lens of a gastroenterologist. A neurologist is looking at it through the lens of a neurologist. A rheumatologist is looking at it through that lens. So none of these things ever kind of connect. So when we treat the whole person, we look at the big picture and we start to connect the dots. We also look at diet, lifestyle, environment, things like that. They're kind of outside the bounds of normal medicine to see if those things are causing problems. So for instance, if you had a stomach ache and doctor said, well, we need to do surgery. Well, nobody asked, well, what did you eat? Are you really stressed? Oh yeah, I have a deadline coming up at work. Those are some things that can cause that pain. So we're looking at the big picture before jumping to conclusions. We look at it all. What are some of the other things that we do? Naturopathic doctors get to the root cause of disease. And again, it goes back to that treating the whole person. We connect the dots, we can get to a diagnosis much more quickly and much more accurately, and we get to the root cause. We don't chase symptoms around. You can have a stuffy nose, but what's really causing that? Did you inhale something in the environment? We want to know that so that we can eradicate that, because oftentimes when you get to that root cause and pull that string, all of the other symptoms of a disease can come along with it. All right, quiz time. What is the root word of doctor and what does it mean? It's actually docere, and this is another naturopathic principle. You might think that that is a Latin term that means to heal. No, it means to teach. Doctor means to teach. And so nobody ever leaves our office without direction. When we go through laboratory tests, we go through the jargon. When there is a condition that we need to explain, we make sure that you understand, and it's also an opportunity to partner up. So nobody ever leaves our office without knowing exactly what's going on. That's the docere part of what a naturopathic doctor does. And finally, we focus on prevention. This isn't sexy. We totally get it. But naturopathic doctors are experts at preventive medicine. You have to understand that 75% of the diseases that cause all mortality in the United States of America are all largely preventable. These cost the country almost $4 trillion a year, and they're all preventable. So what are we doing about it? Well, come see a naturopathic doctor like myself and we can help you down that road. I think most of us, we like to wait till the last minute, but when it comes to chronic disease and to heavy hitting disease, I'm talking about the heart diseases, the cancers, the Alzheimer's, You want to catch these things as early as possible or before they're ever an issue. If you're doing all the things correctly and have a great quarterback and a naturopathic physician, you can live a long life and outlive all of these diseases and never feel over 40.